Yeah, so this was a phase 1 dose escalation evaluating the inhibitor of ATR, which is part of the DNA damage response, in combination with the TOP1 inhibitor Irinotecan in patients with advanced solid tumors. So we were able to establish the recommended phase 2 dose and the safety and tolerability of the combination. Within dose escalation, I think one of the encouraging signals of efficacy were in 2 pancreatic patients previously heavily pretreated who actually had prolonged and durable responses and deep responses. And it's interesting in that their genomics actually had biallelic loss of ATM, which is also part of the DNA damage repair pathway. So it's suggestive that potentially these are patients that could have particular benefit to the combination of irinotecan with the ATR inhibitor. So those toxicities were primarily the toxicities of irinotecan with myelosuppression and diarrhea. It actually was a fairly well-tolerated regimen without anything surprising in terms of excess toxicity.